Well, spring, summer, fall, many of us have seasonal allergies, or at least what we think are seasonal allergies.
Dr. Scott Joy, Chief Medical Officer with Health One Physician Services Group, joins me now. Dr. Joy, 'tis the season, allergy season. We know that a lot of people develop allergy symptoms this time of year, but it does depend on the year. So how are things stacking up allergy-wise so far?
So I think, Jason, in my experience here in clinic, we've seen very few calls thus far for allergy symptoms. I think that's due to a lot of the precipitation we've had in the Denver area. The snow, the moisture has kind of kept the pollens from getting airborne, keeping the flowers from fully blooming, keeping the trees from blooming early. So those are what precipitate the allergies. And I think the precipitation has helped keep that down in the Denver area.
As we move into full-blown allergy season, though, for the last multiple years, when people wake up and they feel under the weather, the first question is this COVID? So how do you tell the difference between just your seasonal allergies and potentially a COVID infection?
Yeah, I think the things that we're listening for from our patients in clinical practice is, do you have a fever? Are you short of breath? Do you have significant muscle aches and fatigue? Those are symptoms that make us think it could be more of an infectious process rather than an allergy process. So I think having a thermometer at home, having a way to monitor your oxygen at home if you have heart disease or lung disease, those are really important pieces of clinical information to share with your provider.
So if I wake up tomorrow morning and I have a cough and I'm sneezing, do I go to the store to get cold medicine? Do I go to the store to get allergy medicine? Do I immediately make an appointment with my doctor, or some kind of combination?
Yep. So one of the things I heard from you, Jason, is sneezing. Sneezing is a symptom that is uncommon with COVID. So that, in my clinical mind, makes me think you probably have more of an allergy component, maybe even a little bit of an early virus other than COVID. But I would also do some follow-up questions. I would say, Jason, are you short of breath? Do you have some exposure to people that might have had COVID? Luckily now in the Denver area, the positivity rate is low. But I think one thing that's very important this allergy season is to make sure our viewers and our patients have access to at-home COVID tests. That is going to be a very important piece of information, along with sharing with your doctor what your temperature is, what your oxygen level is, and what your at-home COVID test results are. That's going to be very helpful to get us the care that you need.